Coming into the today's topic, today is a continuation of the last class, that is the growth of cranium. So today we are dealing with the postnatal growth of the cranial vault. Am I audible to all? Can you see the slides or point slides?
Yes, sir.
Okay, let's continue. So coming to the postnatal growth of the cranial vault. So postnatal means it is the period after birth. So we all know that the total number of bones in the adult skull is 22. Out of 22 bones, the 8 bones are composed of the brain case, that is the calvarium or cranium, and the 14 bones are the included in the facial skeleton. So when we see the growth completion of cranium, maxilla, and mandible, we know that up to 6 years or 1 to 5 years of age, 85% of cranial growth is completed. By 10 to 20 years, only 4% of cranial growth is remaining. But in the case of maxilla and mandible, only 40 to 45% of growth is completed by the first 5 years. Rest, almost 35% of growth is remaining after 10 years up to 20 years. So mostly maxilla and mandible keep on growing till the age of 20 years. The neurocranium is the first to achieve its maximum growth potential before 10 years and completes its growth after 12 years. So we know that cranium composed of various flat bones like parietal bone, frontal bone, occipital bone, temporal bone. All these bones are separated by the loose connective tissue, understood, which is known as fontanelle. So fontanelle is later, which is deposited by the bone by the age of 2 years and form the sutures. So these are the structure of the cranium. You can see frontal bone. These are the two parietal bone, temporal bone, occipital bone, and they are separated by the various sutures. And because the postnatal growth of the cranium takes place because of the growth of the or deposition of the bone at the sutures. Coming to the mechanism of growth of the cranial vault. The first mechanism is apposition, then surface remodeling, periosteal growth. These are the three mechanisms of growth taking place in the cranial vault. Apposition means it is simply the deposition of the bone takes place at the various sutures of the cranium. As I told before, there are various sutures in the cranial vault which are connected by the various flat bones like parietal bone, temporal bone, frontal bone, etc. The deposition takes place at these sutures are known as appositional growth or sutural growth, which plays a major role to expand the cranial bone. Second mechanism is remodeling. That is, you must have know about the what is remodeling. It is the combination of both deposition as well as resorption. So because of the resorption from the inner side of the cranium and deposition from the outer side of the cranium grows or enlarges. It helps to increase the internal volume, or it helps to increase the space for the brain to occupy inside the cranium. The next mechanism is the periosteal growth. It is also similar to that of appositional growth. That means deposition of the bone takes place on the outer periosteum, and which leads to increase in the thickness of the cranial vault. The height of the cranium is completed first, followed by the width and depth. Depth of the cranium completes at last. Next, coming to the postnatal growth of the cranial base. Cranial base. So cranium is divided into cranial vault and cranial base. And just before we discussed with the postnatal growth of the cranial vault, then coming to the postnatal growth of the cranial base. So the postnatal growth of cranial base takes place mainly three growth process, or there are three mechanisms. during the postnatal growth of the cranial base. First is cortical drift and remodeling. Second is elongation at synchondrosis. And third is sutural growth. What is cortical drift and remodeling? That is remodeling, I have discussed before. It is a process of combination of both bone deposition as well as resorption. So there are various depositions and resorption takes place at the various regions of the cranial base. We all know that cranial base is not a plain or uniform surface. It has various ridges, various concavities, and various foramina for the passage of the blood vessels and the nerves. So there is a deposition as well as resorption occurs, which bring changes in the size, shape, and the relationship of the bone. The elevated bridges are the bony partitions, which shows the bone deposition, and the floor of the cranial base shows the bone resorption. So because of this resorption and formation of the concavity, it helps to accommodate the more brain tissues to increase the intracranial space. The next mechanism is the cortical drift. What is cortical drift? It is the movement of the bone towards the deposition site. So cranial base is, we all know, cranial base is perforated with various foramina for the passage of blood vessels and nerves. Then this foramina is maintained their size or shape by continuous bone deposition as well as resorption. Second is the elongation of the synchondrosis. Synchondrosis, we have already discussed, it is a cartilaginous joint between the bones of the cranial base. So it is basically a temporary cartilaginous joint between the bones of the cranial base. There is a band of cartilages. Cartilages remain at the junction of the bone. Which is this synchondrosis is the important growth center of the cranial base. That means when we transplant some part of the synchondrosis to other region, which may get which grows in that new region. So histologically, it is a double-sided epiphyseal plate which is positioned back to back. The area between the two bones consists of a growing zone of reserve cartilage. That means, so when we see this, which is a synchondrosis, this is spheno-occipital. This is the occipital bone. This is the sphenoid bone. The cartilaginous joint between the sphenoid bone and the occipital bone is known as spheno-occipital synchondrosis. We can see the both epiphyseal end of the sphenoid bone as well as occipital bone. In between these two epiphyses, there is a band of immature cartilage. Histologically, you can see a band of immature cartilage, which later maturation to form the endochondral ossification and form the bone. So there are various synchondroses: spheno-occipital, spheno-ethmoidal, intersphenoidal, and intra-occipital. Spheno-occipital means it is the cartilaginous joint between the sphenoid bone and the occipital bone. This is the picture of the spheno-occipital synchondrosis. This is the also known as the anterior cranial base, which extends from the sella to nasion. So you can see the growth of the spheno-occipital synchondrosis mostly by the age of 12 to 15 years. After 15 years, the growth is completed. So the sphenoid and that cartilaginous joint is fused by the age of 20 years. Maximum growth you can see by the age of 12 to 15 years. So because of the growth of the synchondrosis, there is increase in the width and length of the sphenoid bone as well as the occipital bone. The stimulus to the growth at that synchondrosis is obtained by the pressure which or compression which take exerting on that particular joint, which is exerted by the weight of the brain or face. The direction of growth of the spheno-occipital synchondrosis is upward direction, which carries the cranium in the forward direction. The next is the spheno-ethmoidal synchondrosis. It is this in this picture. In this picture, you can see this is the center portion of the bone is sphenoid bone. Anteriorly, you can see the ethmoid bone. The joint between the sphenoid bone and ethmoid bone is sphenoethmoidal synchondrosis. So this joint ossify or which get calcified by the age of 25 years. Then this is another joint that is inside the sphenoid bone. It is intersphenoidal synchondrosis. This is joint ossify or calcify at the age of birth, at the time of birth. And there is another synchondrosis or cartilaginous joint inside the occipital bones, which is known as intraoccipital synchondrosis, which gets ossified by 3 to 5 years of age. So this is all about the various synchondrosis. These are the cartilaginous joint. Coming to the third mechanism of growth of the cranial base is sutural growth. We all know that various bones are joined by the various sutures. So because of the bone deposition takes place in the sutures, which plays an important role in the growth of that particular bone. There are various sutures in the cranial base: spheno-frontal suture, frontotemporal sutures, sphenoethmoidal sutures, frontoethmoidal sutures, and frontozygomatic sutures. Because of as the brain enlarges during growth, there is a bone formation occurs at the ends of the bone at either side of the sutures. Because of the enlargement of the brain due to the functional demand, there is a tension developed at all the sutures, which stimulates the osteoblast and thereby bone formation takes place. Coming to the timing of the cranial base growth. At birth, the cranial base, 60% of cranial base growth is completed by the time of birth itself. By the age of 7 years, 94% of cranial base growth is completed. By the age of 13 years, almost complete, that is 98% of growth is completed of the cranial base by the age of 13 years. So, this is the end of this class. So in this class, we discussed about the growth of cranium, prenatal and postnatal growth of the cranium. The next topic, we are coming into the growth of maxilla and mandible. If you have any doubt, you can ask me, you can stop me and ask me. So coming to the growth of maxilla is also divided into prenatal growth of maxilla and postnatal growth of maxilla. So prenatal means that is growth of maxilla takes place before birth. Postnatal means after birth. Coming to prenatal growth of maxilla. So we all know that nasomaxillary complex, that is maxilla and nose, is a complex. This complex develops from the first branchial arch. In the last class, in the previous class, I have discussed about the formation of pharyngeal arches or branchial arches. There are 6 branchial arches. Out of this, 5th branchial arch disappears, and there will be finally only 5 branchial arch. First branchial arch is also known as mandibular arch. From this mandibular arch, the dorsal end of the mandibular arch, there is a bud develops by the age of 4th week of intrauterine life. This dorsal end of this mandibular arch, a bud develops. The bud enlarges and which grows mesially to form the maxillary process. So maxilla is a pure intramembranous bone. That means there are 2 types of bone formation, intramembranous as well as endochondral, that we have discussed in our previous classes. Intramembranous means the bone is directly formed from the undifferentiated mesenchymal cells. There is no intervening cartilage formation. So we all know that primary calcification or ossification center of the maxilla is at the nasal cartilage, nasal septal cartilage. So by the 4th week of intrauterine life, what happens? There is a prominent bulge developed at the forehead of the embryo. That bulge, which
Sir,
yeah,
slide.
slide is not visible.
No, sir.
Just 1 minute. Now is it visible?
Yes, sir.
Okay, let's continue. So now we are discussing about the prenatal growth of the maxilla. So coming to the various branchial arches that we have discussed, there are 5 branchial arches. First branchial arch is the mandibular arch from which the maxilla develops. So during the 4th week of intrauterine life, there is a bulge appears at the ventral part. You can see there is a bulge developed at the ventral part of the embryo. This is known as frontonasal process. This bulge which enlarges and which covers the chomodium, that is the concavity seen just behind the frontonasal process, is known as chomodium, which is the future mouth or oral cavity. The chomodium is separated from the foregut. There is a buccopharyngeal membrane which separates the mouth with the foregut. Later, the membrane gets ruptured and the mouth or oral cavity comes in continuation with the foregut. So, as I told before, the mandibular arch is the first arch which develops. From the dorsal end of the mandibular arch, a bud develops. That bud is known as maxillary process. This process which grow medially and fuse each other to form the maxilla. So before that, as I discussed before, there is a prominent bulge which is known as frontonasal process. On the frontonasal process, there is a mesenchymal thickening. You can see. So when we see this figure, this is the frontonasal process, this is the maxillary process, and this is the pericardium. On the frontonasal process, you can see two bulge, two mesenchymal thickening on either side of the frontonasal process. Here you can see this is the thickening. This is known nasal plug cord. So the nasal plug cord divide the frontonasal process into medial nasal process and a lateral nasal process. So this is the mandibular process. From the dorsal end there is a bud which is known as maxillary process. The mandibular process grow medially fused to form mandible, and maxillary process grow medially fused to form maxilla. So initially the maxillary process fused with the lateral nasal process, that is the part of the frontonasal process. As it grow medially, it again fuse with the medial nasal process. So the medial nasal process and lateral nasal process are the part of the frontonasal process by dividing with the nasal plug cord. The nasal plug cord which gets depressed and to form a nasal pit, that is the future nasal external nails. These are the two nasal pit. And this region is medial nasal process, and lateral part of the nasal pit is the lateral nasal process. So in this picture you can see this is the maxillary process. This is the nasal pit. Initially nasal pit is in the continuation with the oral cavity. As the maxillary process grow medially, the nasal pit get detached from the oral cavity. So when we see this picture, you can see the maxillary process grows medially and the nasal pit or external nails gets detached from the oral cavity. So from this picture, you can see the cheek area of the face is purely formed from the maxillary process, but the philtrum or the medial part of the middle part of the upper lip is formed from the medial nasal process or from frontonasal process. So similarly, the nasal septum is formed from the frontonasal process. So this is the brief idea about the formation of the prenatal growth of the maxilla. So as the maxillary process grow medially, nasal pit gets separate out from the oral cavity. So coming into the theoretical concept, so from this figure you can make out the upper portion is frontonasal process, which divide into two portion, medial nasal process and a lateral nasal process by formation of a nasal plug cord. The central portion is stomodium. As the maxillary process from either side of the stomodium grows medially or moves medially. It fuse with the lateral nasal process and the medial nasal process. So the nasal pit gets separate out from the stomodium. So which are the parts which arise from the frontonasal process? The forehead region develops from the frontonasal process, nasal septum, and as well as the philtrum of the upper lip and the premaxillary region are formed from the frontonasal process. So these are the same thing as I discussed before. So maxilla, once the maxilla fuse with the medial nasal and lateral nasal process, then the ossification takes place at the three ossification centers. One is in the maxillary proper and two are for the premaxilla. So sixth week of intrauterine life, there is a ossification center developed at the maxilla proper. This ossification center is at the infraorbital nerve foramen. So primary ossification center is at the infraorbital nerve foramen, and that is for the formation of the maxillary proper. The second ossification center, one is at the nasal septum and other is at the incisive. Second center is at the nasal septum, which helps in the formation of the premaxillary region. Then there are secondary ossification centers at the zygomatic bone, pituonasal and the nasopalatine region. So once the maxilla fuse with the frontonasal process, then the ossification takes place in the various centers. So coming into the various structures developed from the various prominences, like frontonasal process, which develops into the forehead, nasal septum, then the nose, philtrum, premaxillary region, ala of the nose. Maxillary process, which develops into cheek area, the lateral part of the upper lip, and the secondary palate. Mandibular process, which develops into lower lip, chin, and the lower cheek region. These are the various structures of the face which develop from the various processes. So upper lip is formed by the fusion of maxillary process with the medial nasal process. Thus, lateral nasal process will not contribute to the formation of the upper lip. So upper lip is mainly formed by the fusion of maxillary process with medial nasal process, and the philtrum part of the upper lip is formed from the frontonasal process. So these are the same pictures which I discussed before. Coming to the development of maxillary sinus, the first sinus developed in the human body is the maxillary sinus, which develops at around 4th month of intrauterine life. So which develops by the invagination of nasal mucous membrane into the maxilla proper, and later the enlargement of maxillary sinus by the resorption from the internal wall of the sinus. Coming to the development of palate. Palate developed at the time of 6th week of intrauterine life. The premaxillary region of the palate developed from the frontonasal process, but the secondary palate developed from the maxillary process. As the maxillary process grows medially, it forms the palatal process. This palatine process which grow medially to form palatal shelves. So in this figure, this is the premaxillary region, and these are the secondary palate. So secondary palate formed by from the palatine shelves. So in this figure, you can see the maxillary process as it grow medially to form palatine shelf. The palatine shelf grow initially. The palatine shelf grow vertically downward because of the interruption with the tongue. But by the age of 8th week of intrauterine life, there is a transformation from the vertical direction into horizontal direction. There are various reasons for this transformation of the direction of the growth of the palatine shells. So by the 8th week of the intrauterine life, the palatine shells from both sides get fused in the middle. Initially, it fused in the anterior region. From incisive fossa, it fused posteriorly, and the ossification of the palatine process takes place only in the secondary palatal region, and the posterior region, the palatine shelf doesn't get ossified, which form the soft palate. You can see here the fusion of the palatine process takes place in the anterior to posterior direction. Once the palatine process gets fused, the nasal septum grow downward and fused with the palatine process. Thus, the nasal cavity, both right and left nasal cavity, gets separated from the by nasal septum, and the nasal cavity gets separated from oral cavity. So, as I told before, the two palatine processes which grow medially to form palatine, which form the secondary palate, primitive premaxillary or primitive palate develops in the frontonasal process. As I told before, the transformation of the direction of the palatine shelf is because of the various reasons. One, because of the alteration of the biochemical and the physical consistency, alterations in the vasculature, mitotic activity, intrinsic shelf force, because of the withdrawal of the tongue and various muscular activity. All these reasons, there is a transformation of the direction of the growth of the palatine shelves. So, coming to the ossification of the palatine shelf, so ossification of the palate. By the 8th week of intrauterine life, the ossification of the palate starts. Mainly, it undergoes intramembranous ossification, but the posteriormost part of the palate doesn't get ossified, which forms the soft palate. The mid-palatal suture gets ossified by the age of 14 years. So, till the 14 years, we can expand the mid-palatal suture by using the various maxillary expanders. If there is any abnormality or defect or non-union of the fusion of the palatine shelves or with the frontonasal process, which results in the cleft lip and the palate. So non-union of the premaxilla and palatal shelves, which give rise to the cleft. So coming to the postnatal growth of the maxilla. Before that, please take the attendance. Class rep, please take the attendance by taking the screenshots. So postnatal growth of maxilla we can take in the next class. Am I audible?
Yes, sir.
Yes, sir.
Okay, please take the attendance. We can wind up the class. The postnatal growth topic we will take on the next class. Okay. So I am going to end this slide share. Did you take the screenshots?
Yes, sir.
Okay, we'll close this slide share. We'll meet on the next week. Okay, thank you.
Thank you, sir.
Thank you, sir.
Thank you, sir.